So we're really excited to talk about something that we have not explicitly talked about, I don't think, on this call before, although I know a lot of you are funding it, which is food insecurity, basic needs, but food insecurity specifically in this time with the pandemic. And we're really excited to have one of the foremost national experts in this, Jerry Henchy from FRAC, join us to talk about it. But before I turn it over to Jerry, there were a few things that I, pulled out that had this in my mind, and we can chat it or share it, resources after we frequently do. And I think I see Joan's iPhone, so she was instrumentally involved in this. If any of you had checked out the latest Rapid EC study that came out last week, we've had the investigators from that study speak to us in the past, tracking real time what's happening with families in the pandemic. One of the most recent ones was about basic needs, and a couple of things that really stood out to me was like the amount of material hardship, financial difficulties that people are experiencing right now. And just a couple of the things that came out was that in low-income households, 69% of low-income households were experiencing some kind of material hardship, that's basically 70%. And a third of them were experiencing food difficulties, even with all of the ramping up of like schools delivering meals and all these things. We still had, this was recent since it's a tracking, a third of low-income families saying they were experiencing issues with food. The other thing that I would suggest, if you haven't seen it, we will send it out after. Part of what sparked this was that we also have SA working with us around immigrant families, and there were real race and ethnic disparities that showed up in that Rapid EC data, and that's what prompted her to say we should be talking about food and basic needs. So when you look at that study, which, like I said, we'll send it out, Latino and Latinx households, a quarter of them overall reported financial difficulties, separate from whether they were low income at the start of the pandemic. And over half of them said they had some kind of material hardship, which was more. And the same, Black families were similar. And the other thing that was really, that jumped out at me about that particular report was Black and Latinx families were experiencing losses of income at greater rates than other families, regardless of the income level they started at, right? So there's an income effect, but then there is, independent of the income effect, there is a race and ethnicity effect, which, as we've been working on racial equity at ECFC, we've been thinking about the way that too often, as a field, we've assumed that income is a proxy for race and ethnicity, and this data helps explain why there's an independent analysis around race and ethnicity in addition to the income. So I just wanted to call that out, and we'll share that. So all of that is why we're very excited to have Jerry with us, and I won't do a long intro. I didn't even pull your bio, but Jerry is the national expert on nutrition policies for young kids at Food Research Action Center, and really she probably knows more about some, especially CACFP, but several of the programs, probably more than anyone else, including people who run them at Department of Agriculture. They often call her as the shadow government expert, and so we're really excited to have her. So I'm going to turn this over to Jerry.
Okay, well, thank you, Shannon. It's great to get to work with you again. You did so much over at HHS, and I see you're just right on top of it here too, so it's good. Good. And I'm also happy to be on with all the different people who are doing funding on this issue across the country, because I know you make really important work happen, and I want to thank you for that. So I am going to do a screen share now to pull up my PowerPoint. which I have to say I got carried away with the pictures and couldn't send because it got too big. So can everybody see that? Does it have a little mark on it, or can you see it?
I think we can see it. Yep.
You can see it. Okay, great. All right. So as Shannon said, I'm going to talk about food insecurity, disparities, and food access in early childhood. And so what I'm going to do is focus on some of the substance of the issue of food insecurity and disparities in COVID-19, which Shannon already began discussing, which is great. And then I'm going to talk about maximizing the federal food programs for young children during COVID-19 with a particular emphasis on WIC and CACIP. So I thought I would start with this because Shannon and Joan did send me that study. So this is perfect because it's a great segue to what Shannon said, but Black and Latinx households with young children are, as Shannon said, really experiencing high rates of income loss, financial difficulties, and material hardships. And then I'm going to really focus on food insecurity. So what we have is unprecedented levels of food insecurity, really. And so 1 in 5 adults is experiencing food insecurity. And for families with children, it's much higher, 1 in 3. But then if we turn, as Shannon said, and we look at the differences in the racial ethnic data, we see again and again and again. In fact, Census is looking at this every week, and other organizations are looking at it periodically over COVID-19, and we always see the same thing. Much higher rates, much higher rates for Black and Latinx families. So we don't have information on Native American families, but we know that they are in the same category, and we're going to try to figure out if we can get some more information on that. But this is a recent article in Politico, and they also made that a big deal, which is important. I think it's important that it's true, and it's also important that it's actually in the press, that people have figured it out and are focusing on it. And that's one thing that we also keep really trying to push. And here's an example of the specifics of how high it is. So if we're talking about Hispanic and Latinx families, 47%, that's basically half the families with children. And then as Shannon said, when you look at this, this is actually not the low income. This is regardless of income. And then in this case, the most recent data here is 29% for Black families. We also see that go higher in different surveys. So that can go up actually to 39% really in some other surveys. So we really just see astronomically high levels here. And so what does that mean? It's associated with a range of serious consequences. I mean, short-term and long-term. So we're talking about early childhood, and I'm sure that you talk all the time about this sets the stage for the rest of people's lives. Well, food insecurity is going to interfere with health and well-being. It's going to interfere with learning and development. It's very serious. And so one of the things among the many things that I'm sure that you have tried to look at in terms of addressing making a good early childhood for kids is the federal food programs. So during COVID-19, these are particularly important, but we know that they actually can help to reduce food insecurity. They can improve dietary quality and well-being, and because they actually have a cash value in terms of a place in the budget of families, they can help with some poverty issues. So I did this for our talk. So I don't know, I'm gonna move this. Can you see that there's this little thing across the top here, or can you just see the slides? You can see them now? Okay. So these are basically, if you think about supporting food security and good nutrition in early childhood during COVID-19, these are the key state and local systems where the federal money's coming down into these systems, and then they have a part in good nutrition and food insecurity. So first of all, and very primary to early childhood, is childcare. So that's early care, but it's also after school and wraparound care, right? And the federal food program that comes through there is the Child and Adult Care Food Program. Then if we're talking about young children up to, age 8, which is what I think is the group that you're looking at, we're talking also about school. So we're talking about elementary school and then school-based pre-K and then after school. And there we're talking about school meals and summer food as well as CACIP. And then if we switch over to not the places that young children are in, but their family, We have both health, so that's WIC, right? So that's coming through public health, and that's food. But then we also have Medicaid, because Medicaid has some provisions where they can both do outreach on the food programs, but they can actually provide food in some places. And well, they can do it in any place, but for some reasons. And then public benefits, which is SNAP. So the big federal programs, as far as food programs, are WIC and SNAP. But if it's sectors, then we've got childcare, we have school, we have public benefits, and we have health. So these are all important things, and they're important during COVID-19, right? Because even though the programs aren't functioning the way they normally would, there are special rules. So we did send ahead a guide that we have, which is also available in Spanish. We did a version with Unidos, and we have that. And then we have this fact sheet. So those were for you to review. But what I really want to kind of burrow down into a little bit for our conversation is WIC and COVID-19, and then CACIP and COVID-19. So I'm going to do WIC first and talk about what are the special program rules, and then how about what do we have to say about reaching and observing families. So the Families First Corona Response Act, you know, that was like 3 economic stimulus bills ago. So what happened is, actually at FRAC, we have an annual conference. It was one of the last big conferences to happen. And we invite USDA. And so we have program operators and advocates and everyone. And so COVID-19 was coming, and people were trying to figure out what would it mean. So the way we conceived of it was, well, what the food programs do when there's a disaster, right? Because there's special rules. So we started talking to USDA and saying, well, this is what people think are going to have to happen. The food programs are going to be able to do this, this, and this. And they said, look, we don't have the authority to do that. You're going to have to go to Congress and get us authority, and you're going to have to get us more money. So that's what people did. Went to Congress, got additional authority, and got more money. So on WIC, that meant that they got $500 million. And I'm sorry to say that WIC is only spending a small portion of that right now. So this is really money on the table that we need to get spent. Then also waivers that allow participants to be certified without being physically present in the WIC clinic. And it also expanded the authority in some other ways, which I'm going to go into. So this is one of the absolute key ones. Normally with WIC, to get enrolled or re-enrolled, you have to go and you have to bring your child and yourself to a WIC clinic. Well, social distancing made that impossible. And when it first happened, which for example, like Massachusetts was the first state, they just shut down. So people started calling us, advocates started calling us and saying, like, mom's coming in, she's got her baby, she had her appointment, she wants to get the baby on, and the door's closed, and there's like a sign on it that says, well, WIC's closed, call us if you have any questions. Well, if you called and had questions, they couldn't do anything for anybody to start with, because they just didn't have a way to serve people over the phone. So they have the waivers to serve people over the phone or via the internet now. We did a whole thing on WIC and technology, and the places that had started to move forward a little bit on technology are in a better place than this. Mostly they do it over the phone. So a little bit on the internet, a little bit telehealth in some places. But this is great, really great. It'd be great even if there wasn't COVID-19, but it means that people can get on, and it's something we really want to get the word out about. And another key piece of this is that, so normally you have to come in or you have to bring your height, weights, and hematocrit, but because we were saying nobody is going to be able to go anywhere and get their height, weight, and hematocrit, they just need to get on, because most people are, who are applying are at risk anyway if they're in that income category, because it's easy to do. So you don't have to have it. If you have it, it's good, but you don't have to have it. You just call up and they can put you on. So what's the other two of the 3 key things on WIC? Remote benefits issuance. So here, technology is key. Almost all the state agencies have EBT now because they were mandated by Congress. So that means that most of them can download benefits out of the cloud, but mostly they only give people 3 months of benefits and then they'll make them come back in again. But during COVID-19, they can just download them. There's waivers that let them just download them. Again, this is important for newly eligible people, which of course there are a lot of, but it's also important for people who are already on the program and maybe just couldn't figure out how to get, you know, to the many appointments you have to go through for WIC. And so they just stopped giving them their benefits, even though they were still eligible. Well, now they can just download them and they have this waiver and they should be doing it. And this is really important too, I think, during COVID-19. And then this is the final thing I'll say. So because there were supply chain disruptions at stores, which we all know about, there were some things particular to WIC that have to do with, you know, you have to really have just like a 1 pound loaf of bread for an unknown reason, you know, waiving that, not saying you, well, okay, if you can't find non-fat milk, you can have low-fat milk or whatever milk you can find. So these waivers were also important because people are going to the store and they couldn't find everything they needed. And so most of the states have these, and most of them did it for milk, and the second most common is bread. But it's trying to say these food programs and people with young children have to function within social distancing, but also whatever's happening with the food supply chain. So these are the recommended strategies, you know, that we recommend to people to do. And so conducting WIC outreach through networks and communities and really trying to make sure, you know, the people who are traditionally underserved are hearing about this, making sure the people who are newly eligible are going to hear about this. For example, we were talking to a big insurance company and they told us they thought they were going to get 1 million new Medicaid people coming in because of COVID-19. Well, they should be asking every one of those who has someone in the right age category, they should be asking them, you know, are you on WIC? Can we tell you how to get on? So people have to understand they don't have to be physically present and that this continues. We just had a big fight, actually, because the administration didn't want to keep allowing these waivers for WIC. They were going to let the waivers for child nutrition go forward, but not for WIC. But in the end, they did because there's a lot of pressure. So these waivers will continue at least until September. And then the other, you know, in terms of, as Shannon was saying, you know, one thing that we really have to think about is our immigrant communities, which really actually do make up a substantial proportion of young children in the country. Are we making sure that WIC is working for them? So it's especially important when you get a quick change like this and someone has to know about it. And if they don't, they can't get the benefit, that it's in the right language. People really need to have it in the right language. And then people need to work with the trusted communities to get that word out so that people trust that it's okay and they can go there and they're not as worried about public charge. One of the things that has changed about public charge, I think, is that what some people are saying, like, for example, for WIC and doing WIC outreach, when we did a webinar with Unidos about it, people were saying, if you have a concern about it, you should consult with, you know, your lawyer if you're in the middle of a process of trying to become a citizen or you think you're going to. But, you know, if it's an urgent need, if you have this kind of food insecurity, pressing economic hardship situation, then just give it a try. You know, go ahead and you know, first priority, you're going to have to put food on the table and, you know, move forward with it. So people, the chilling effect of the public charge debate has declined. It's not eliminated, but it's declined. And then finally, encouraging the state agencies within those supply chain issues to allow flexibility for cultural food options. So like if you can't find rice or because it has been hard to find rice and that kind of stuff. So those are some of the general things that we were recommending around making sure underserved and newly eligible people were on. And this is examples of it. So these are really kind of good examples. This is how other people can get out the word as well as WIC. This is some of the things that people can know about. Like, for example, you get food, but WIC has really tried to do a lot over the phone in terms of breastfeeding, helping new moms. Also, like if there's problems with the older preschoolers, really trying to help over the phone. So that's important. And then it should all be in Spanish. So this is an example of it in Spanish. So let me turn now to CACFP. Again, just going to talk about what are the special program options, what are some opportunities and things that people have been doing. So again, Families First Act, three provisions. And these provisions are provisions for CACFP, but they're also provisions for school meals and for summer food. So when we talk about schools and what schools are doing and all the food that they're putting out, all the grab and go, all the deliveries, all the things they're doing, they're using the same waivers. So these waivers work for all the child nutrition programs. And so what these waivers do is that they allow flexibility. And one of the big things they do is they allow non-congregate feeding sites. So that's grab and go and delivered. CACFP preschool hasn't done this as much as schools have. We've seen schools do this big time. Everyone's seen that that's been going on. Often they're actually switching in some cases to summer food because they can serve a bigger age range. And so it's schools that are picking up the preschool kids because they're giving meals to families that come for all the kids of all ages. And some of the childcare people know that, and so they just yielded it to the schools. In some cases, it's simply that if you look at the early care and education structure, the sophistication and size of most childcare, it doesn't lend itself to switching very quickly to actually doing meals that you could give someone to carry off. But people are doing it. And just to give you some examples, this is UNC's Head Start program. They went right for it. They have, as you can see, this is a pickup option. And then over here, they're doing delivery. So that's in Southern California. Those of you who are from Southern California, like actually I am originally, know that there's these whole neighborhoods where there are all these apartment buildings that people live in. And then that's what they're doing. They're pushing it around to give it to people. I would also note that the whole idea that this must be done consistent with health requirements changed over time, because you can see that everyone, and this one picture, which is the very beginning, where they weren't wearing masks because we didn't know that everyone had to wear masks. Now in this picture they are. This is an example of like, okay, everyone's got masks on, that's what we have to do. And this is another way of people doing it. This is a CACFP program. It's a preschool program and an after-school program. It's called It Takes a Village to Feed One Child. But they started doing grab and go. And here also you see a development, a change. You see it in CACFP, but you also see it in schools. And that is waivers came in saying you could put the meals all together. So someone could come get it for a whole day, or they could go get it for a whole week, and it changed the delivery mechanism. The other thing you see here is, again, the waivers. There was a waiver that you don't have to bring your kids with you. Because to start with, people are like, well, we got to see your kids because that's the rules. And they were right, that is the rules. And they have to go by the rules or they're going to get in trouble. So then there was a waiver that said, yeah, you don't have to bring your kids. I mean, just come and we'll give you the food for your kids. So the other thing that we see here is a combination of the charitable food network, the federal food programs, and the early care and education initiatives combined, right? So this is CACFP food, but they're also giving extra food that they got from the food bank, and they're also combining it with educational supplies and home learning activities. And so maybe people won't come just to pick up learning activities, but they will come to get food and learning activities and extra food if they can, if it's all possible for them. So they're trying to help them on all levels of, you know, bringing together all the initiatives that are in these programs through the waivers. So this is just a preliminary thing, and I'm not going to spend a lot of time on it, but it's just to show you, this is the USDA data for March, which was actually only partially shut down. 29% decrease in meals and snacks that are served. So April is going to be a complete disaster. That means in terms of food insecurity, we are looking at families who before in their food budget were relying on CACFP, and then they weren't getting CACFP. So that's a food insecurity issue. And CACFP has nutrition standards. Those are healthy meals. A lot of money gets put into them. And if you're at home and you have no job and you know you've depleted your savings, the likelihood that you're going to be able to meet that kind of a standard for your meals is pretty low, because you're just going to be trying to get some food in the kids and get them full. The other thing it means is that in terms of the epic failure rate that we're going to see in childcare, it contributes to it. because it means that if you calculate how much money those centers, family childcare homes, after school programs would have gotten before, they're not. Yes, we have to have an alert for this. That's very bad. They're not getting it now. And we do have a hold harmless provision for that in the HEROES Act, but it's just one more reason that they're in trouble, because of course childcare has fixed costs that they intended to pay with this CACFP money. So even if they didn't put food out, the part of their fixed costs in their budget, they're just not getting it. So whatever they planned on paying for their rent, utilities, their labor, if they kept labor, they are in trouble vis-a-vis this CACFP money, as well as their other losses. So what do we see in CACFP now? Of course, ongoing, trying to serve essential workers, and then reopening of childcare. And what we know about that is that it's going to be really important to try to reach all the childcare, to get the people who are on it now to keep using CACFP, to not be afraid that they can't meet the CACFP rules and also meet all the standards, like whatever their state and local licensing standards are going to be around social distancing, or if they're trying to implement the CDC standards. We need CACFP to be workable for them. And then the other things are these things that we need to see happen, right? So and as part of that, we want to utilize these waivers. There are additional waivers around flexibility. We want to have outreach again and promotion. We want to focus on underserved communities and newly eligible, because I think that, and I was talking to Shannon about this when we were getting ready for it, and other people have raised it too. We may see, family childcare that was underground before might come above ground, or we may see more family childcare happening, right? So they would be newly eligible childcare people, because some people are saying maybe they're going to be more comfortable with family childcare. But we know that family childcare is underserved, and we know, particularly if we think about immigrant communities and the fact that people really want to have their children in a place where they're going to continue to learn the primary language of at least one of the parents, and where there's going to be cultural foodways and infant and toddler and younger children feeding traditions that they're comfortable with, that they are often looking actually at family childcare. So we can't overlook that. Also, we know that if we think about the hardship, we think about the neighborhoods, some of the childcare, that's even childcare centers in some of those neighborhoods doesn't use CACFP. They need some extra help to participate in it. And then establishing coordination, really making sure everything's coordinated between all the systems. And so that means we already know, because of the rules, actually, Shannon, that you put in place, that the state HHS agencies are actually supposed to be doing outreach about CACFP and SNAP and WIC. So that's something that's a coordination that needs to happen. Maximize training and resources is really important. So cross-program kinds of trainings. And one of the things I think it's really important to do is looking at creating synergies between initiatives. So ECE has initiatives like on mental health and ACEs, which are of course increasingly important. WIC can do cross trainings with those agencies that do that. They can do cross referrals. They can figure out if their families need that help and refer people the same way the ECE and the early childhood initiatives can refer back to WIC and to SNAP. So those kinds of things can happen. Same thing with the CACFP and those initiatives. And then I think also special initiatives that are focused on the immigrant community. If they're trying to help women who are immigrants or refugees become childcare providers, you really want to integrate CACFP into those kinds of initiatives. And here's just a few things that people have been doing, in particular during COVID-19. One, focusing on helping childcare providers understand the flexibility so they can keep using the program as they start to ramp up or during essential care. Two, mentoring programs some people have tried, like people who really know how to do CACFP, helping new people. And then three, trying to address supply chain issues. And so there, I saw a really good initiative where the state child care organization worked with the grocery store organization and sorted out how to have talking points for the child care providers to go talk to the grocery store people. Because when these supply chain issues happened, not only were there things that people needed for the meal pattern not there, but because of the smallness of some child care centers and family child care, they shop at regular stores. And so when the stores said, well, you can only have one of these, you can only have 1 gallon of milk, you can only have 2 loaves of bread, they were stuck. They were stuck because they didn't have a way to say, well, I'm not just a family. I actually do family childcare. I actually have a childcare center. I need you to let me have more of these. And so this was, I think, an innovation that was good, where they figured out the talking points and they said, they told the providers like who at the store you need to talk to, and just also just set up a whole awareness with the grocery store people. So I'll just conclude by saying overall, the kind of work, the categories of work that go on around this kind of thing in terms of maximizing the federal food program resources during COVID-19 are federal and state policy advocacy, collecting, sharing, or promoting best practices, facilitating work on outreach and promotion, problem solving for program operators like schools and childcare providers, reducing barriers to SNAP, WIC, CACFP, summer feeding, and school meals participation, and then facilitating community input and feedback on the state and local level by virtual convenings and focus groups, even though it's COVID-19, and then other special projects like the one that I said about mentoring our grocery store. So that's it. That's kind of an overview. What we had talked about, what you might be interested in. So I'll turn it back over to you, Shannon.
Yeah, so we want to open it up for questions. That's what we, normally do. And as folks are thinking about, so you can either unmute yourself because we're, only a couple dozen people, or you can put one in the chat box and I'll invite you to read it or I'll read it. But as we let people wrap their mind around their questions, Jerry, this slide that you have up right now talks about, I think there's implied here ways that philanthropy could help with some of these things because they fund advocacy and they fund outreach. But are there specific things that you recommend that philanthropy could fund? And or one thing I've learned in this job that I didn't fully understand before I took this job is there's a lot of social capital that our philanthropists have. A lot of them sit on their state early care advisory councils. So I don't know how much those early, those ECACs or SACs or whatever we call the state advisory councils, how much they press there. It sounds like the state gets to make decisions about some of these things. Like, so are there ways that people could be using their money, and are there ways that people could be using their social capital and their influence that would be helpful?
Yeah, those are good questions. And yes, that is what this slide is about, because you said, you had told me when we were talking about what to put here, like think of what kinds of things people could fund. But let me do the social capital first, because I think that is extremely valuable. I agree with you. If people are on the ECE planning the state plan and the different coalitions, they really can have something to say about this, particularly because there is that requirement within the consumer education portion of the, subsidy rules that there's supposed to be outreach on the federal food programs. So I think that's important. I think that the other thing that's important is the coordination between licensing and subsidy and CACFP in terms of interagency coordination on the state level. So they can encourage that when licensing and subsidy get new people on, they give that information, within an MOU and confidentiality to CACFP, so that CACFP will actually do outreach to those newly eligible people. So I think that's important. Yeah, those are the two things that I would say. And CACFP, of course, as you know, is supposed to be on those coalitions and committees now, they aren't all on it because some of them don't actually completely understand what the power of those committees is. And I have talked to them about it. But if you are on one of those committees and CACP isn't coming, like reach out to CACP and tell them what it is you're actually doing and why you want them to be there, and really try to engage them, because once they understand, I think they'll want to come. And then in terms of the, yes, actual funded work, this is the kind of work that I think could be funded. This is some of the kind of work actually that some folks on the phone are already, I think, funding. But federal and state policy advocacy, that's all this stuff around telling USDA what the waivers should be, pushing USDA to expand the waivers. It's time consuming. And without that kind of advocacy, I don't think we would be where we are, because there's a lot of tension within the administration between the program experts in the agencies and the politicals. So, and then collecting and sharing, promoting best practices, always really important and has to happen rapidly now, because we're just seeing them and we have to turn them around. So we actually have some of those up on our website. We need to get more, and we need to do more on that. And then the field work of facilitating outreach and promotion and facilitating problem solving. So that happens through national groups, but that also happens through the groups that you might be funding on the state and local level, and trying to bring everyone together to have convenings and to talk about what's the best way to coordinate all of this. That's an overlap with, I think, the ECE kinds of advocacy organizations and the ECE service organizations, agency work, and then different, like anti-hunger advocates in this case, because it's the federal food programs. So I see it, national level, state level. It's always policy on the national level, policy on the state level. Then field work. Where are the problems? What has to happen? What kind of technical assistance do people need? And then these special kinds of initiatives where, you're seeing something that's working, and then you try to get more people to do it, like mentoring. Like in Colorado, when this whole idea of the pop-ups for the essential care happened, the state agency, CACP agency, went to the people who were good at sponsoring centers, the CACP sponsors of centers, and said, will you be mentors for us? Will you take on these new pop-up centers, and will you help them figure it out? And they said yes. But in a lot of other places, people just didn't know what to do. They just kind of said, well, we'll have you go by the normal rules. And then people were going like, your normal rules take months. They have to get on now. So you got to speed it up. So I think that function of really understanding that, particularly because these best practices are going to matter as we go forward, because it's not clear, how it's going to work. So if people are, doing staggered shift care and early care and education, and making other changes like that, or having to go in and out of, being in lockdown versus not being in lockdown, that it's going to be important to have those best practices. And USDA has reached out. We actually just did a survey with our in a coalition with other people. We got like 1,200 people to respond who do CACP, to try to find out what's going on with them and what they need, so that we could tell USDA, because they really want to hear it. So, but I think it's funding opportunities at all levels, and it builds on what the early care and education work that's already being funded, whether it's in ECE or it's in schools.
So Deborah from Packard, do you want to unmute and ask this? Because this was a question that I think probably a lot of people have based on this presentation. And if not, I'll read it. It's quite possible like a kid has popped into your room or something. Okay, sorry. So she wants to know, so you mentioned that WIC is only spending a small portion of $500 million. And at the same time, there's all this food insecurity that we saw at the beginning of the presentation. So what's up with that? Why is it slow spending? And what can we do about it?
Well, I know it's not good news, is it? I suspected it, but but USDA wouldn't tell us. So the way we found out was that when they went to do the appropriations for WIC, they put this really low number in it, the people in Congress did. So we said to them, did you talk to USDA? Is that why this number is so low? And they said, yes. And we said, did they tell you that that money is not getting spent down? And they said, yes. So that's how we found it out. So WIC is increasing participation, but they're underperforming. So they're not increasing it up to the levels that they should. Well, what they have to do is they have to really be pushed to make sure they're serving all the newly eligible people and that they're still serving the people who were on before. It's a big thing for them to change to a phone system. And part of what we have to do is make sure they don't just some of them just will switch back to doing clinic because they really like the kind of old-fashioned way of doing things, which has some advantages. But the problem there is that they're going to abide by social distancing rules. They won't have the capacity. People don't want to go to public health because that's where everyone's going to get tested for COVID-19. So they need to really keep that phone option there. So that's number one. They need to do outreach for it. The WIC does, all the community organizations need to do outreach for it. Early care and education, even if they're shut down, I mean, Head Start has the $750 million of the CARES Act funding to do other things. They can tell people about it. You know, a lot of the ECE people, I think, are still trying to call up their people and give things to their people, even if they're not, they want to help them. They're their families that's part of their mission. They can tell them about this. The agencies can tell people about it. I think just really getting the word out and really making sure it's in Spanish, really making sure it's in whatever language it needs to be in, really communicating. The other thing is, like I said, these big agencies are going to get all these newly eligible Medicaid people, making sure they are doing outreach for WIC. So I think it's advocacy, pushing, nudging, you know, making sure that people are really hearing about it and making sure that the state is serving them on time and can serve them. And then making sure, like, really looking at traditionally underserved communities as well as newly eligible. I think there's a lot of issues around technology with WIC and that they could do more as far as trying to serve people online. So mostly as far as they've gotten is that they have these things that they call, some places have these things they call applications, but basically it's just somebody filling out something and saying, call me. It's better than it was, but there's only one state where you can, where if I'm a mom and I want to get on, I can go online and make my own appointment. That's Virginia. And so if you're doing outreach to people and they call someone, they have to make an appointment and then they have to go back for that appointment, you know, or you do outreach and they can go online and pick the time and make their appointment and then they have their appointment. You know, as far as access, that's significantly different and it makes a difference. So I think using technology is one of the other issues. But if people are funding work in a state, like I know Packard is doing that and does, you know, funds great work, they can, as part of the coalitions that they have convenings, virtual convenings, and look at all these options and get WIC to come and say, well, what have they done so far, and what can these coalition members do for WIC to get the word out, and have WIC explain what's up with the participation data. So, you know, how many women, infants, and children are on, what's their capacity, if somebody calls, how soon are they getting seen? And so just walk through it with them, offer them help, offer them feedback, but at the same time also really, you know, just really nail down what is going on.
I think that's a great suggestion, right? Because you guys could use your power as funders to call people together, or call even the WIC people and say you want to meet with them and like ask them these questions. We've got Philly and DC and Nebraska and North Carolina and Chicago online, you know, like that would be interesting. Portia, it is concerning. Do you have a question, or you just, it is very concerning that people aren't getting the stuff that's been funded. But you're on mute.
Yes,
This is
okay. I just wanted to ask her another question, because there's been so much political controversy around this, as well as SNAP and everything, and there's so many hungry people. Is it that the people aren't coming, they don't know, or is it you don't know this answer, but is it a deliberate attempt not to get it out? And if so, is the best way to put pressure on that is our presence, or someone like us present with the local officials saying this money has to get out, or what's the deal?
Yeah, I think your presence is very important, saying like, have you spent the money? Have you used your money? What are you doing? I think in answer to the question, like what's going on with it, this has been a problem with WIC for a long time. So during the recession, they got a big pot of money like this, and they basically didn't spend it. They increased participation, but not commensurate with what you would see because of the increase in the number. And so they have had problems with this idea of doing outreach. So some states are good at it, and some states aren't. And so some states really have undertaken a needs assessment and said who's not served and who isn't prior to COVID-19. So you have got that problem. So who's traditionally underserved, who might they care more about or less about? And then you lay over it the capacity or lack of capacity that a state might have to change up what they're doing. So to shift from a clinic-based system to a phone-based system, and to do it so fast, is quite an undertaking. And so, like I said, the states that might have been thinking more and doing more with technology are ahead. The bigger states are ahead. But just when I talk about technology, I just want to be clear what I'm saying here. A lot of these WIC clinics, nobody had a cell phone. They had their own cell phones, but the clinic didn't have a cell phone. They had a landline. And then there would be fights because the younger staff would be like, I want us to have like cell phones, and we want the clients to be able to text us documents they forgot if they have them in their phone, if they have access to them. So, like a cell phone's not what we usually think of as technology. I mean, we could take it further than that in the thing that I talked about in terms of their problems with client-facing technology and the computers. But I undertook to look at all the websites to get some kind of answer to your to your question, like to see what were they saying, and some of them just were way better than others. Some of them were welcoming and were explaining how you could get on, and some of them didn't say very much, and they weren't, and some of them were only in English, and but I think that if you lay over those two problems, which is they already had some issues around outreach, and then you lay over their problems with trying to switch it up and really not liking it, really not wanting to do that, then but if you would go and talk to them and say, what are you doing, and and ask too, like, who are your connections to these communities? Can you tell me, in these communities, who are your people? What are the organizations that are getting the word out for you? And what did you give them for COVID-19? So that slide that I showed that had that really nice things, well, they don't all have that. That was kind of like a best practice that, so there are some things like that, and if they need some help with connections, I think, your grantees are certainly people that could be connections for them. But you do have gravitas. I think you do. And with that kind of money on the table, they're going to say they're increasing participation because probably they are. But the question is, are they increasing participation up to the level that you they need to in order to meet all the needs. And, so
And the
often,
equity issue, Jerry, if I can interject there.
Yeah.
Not just are they
Yeah.
increasing participation, but are they increasing participation in the populations that the data is showing are having the most difficulty? Or is it, So there's another question here.
Thank you.
Yeah, there's
You're
another
welcome.
question here I want to ask, because I work with one family as a volunteer, and interestingly enough, I'm glad you brought this up, Liz, because I was trying to figure this out my own self yesterday. For a mom with 3 kids and no transportation, what's the deal with like getting grocery delivery? I've heard a little bit about it. All the rest of us get our groceries delivered, so we don't have to go, right? So can SNAP deliver groceries, and what can we be doing on that front?
Okay, well, so there are pilots for SNAP online ordering, and those are moving ahead. So people are ordering, and then they're going to pick up their groceries.
But not delivery to your house.
So not right now, because
I thought you could get delivery. I thought you could use your SNAP now. Don't quote me, and I'm looking for the information. So like a Walmart online could deliver groceries and payable via your EBT, your SNAP card. But I might be wrong.
Yeah.
And I'm calling from
for
North
the
Carolina.
pilots. Yeah.
Oh, that's
for
just
the pilots.
Okay.
Yeah, no, that's right. Thank you for clarifying that. For the pilots, they can do that. Yes. And more are doing pilots. And that is part of some of the flexibility that's coming out of USDA around SNAP. And so they can't.
Is that a state choice to have a pilot, or is there a finite number of pilots, or should be people pushing their states to do pilots?
Yeah, before it was the finite number, but now they can ask for them. Yeah, so I think that's a big deal, and people do want to push on that. But WIC is a whole nother story, and USDA doesn't want to let WIC have online ordering. And so right now for WIC, they actually just came, not USDA, but another work group came out with a set of recommendations for why the stores could try to do what's called like click and curbside. So basically order online, but then come and pick it up because it can't be delivered. And the reason it's done like that is because the transaction is not completed online. So they're ordering online, then they come and pick it up curbside, and that they complete the transaction. So that's one thing. But I would say that it's a big advocacy issue to try to get USDA to loosen up in terms of WIC and online ordering the way that they have for SNAP. And COVID-19 has been the reason that now states can ask to do these SNAP pilots, and before it was just that they had done a few of them. So, but WIC isn't really making a lot of headway. But I will also say this, the big box stores that are moving on all those SNAP online ordering, right? They've got their all their online systems and their AI all lined up. They're doing all that for SNAP. What they're saying is, we can do this for SNAP right now, but we actually can't do it for WIC right now because we have to get SNAP done, and then we'll take up WIC. And so yes, let's keep lobbying USDA. So interestingly enough, it's the middle and smaller size grocery stores who are trying to figure out how to do online ordering for WIC right now, do this kind of click and curbside. But the bigger ones that have figured out how to do the online ordering for SNAP, there's so many people coming through those systems, like the store systems where you go and pick it up as opposed to Amazon, that they can't interject something so kind of jerry-rigged and uncertain as this backdoor way of doing online WIC. But the smaller stores are. The medium-sized grocery stores and the smaller stores are very interested, and they are the ones who were part of this working group that I was actually on. They're the ones who actually knew what was going on. I didn't. I just wanted it to happen. But it's them, and it's the big, the EBT companies that figured out how to do it. So if people who were on the call wanted to get those protocols that they put together. I could give them to you, Shannon.
And I'm looking, we have 1 minute. I want to actually, Liz, if you don't mind, because we have one example here, if you wouldn't mind talking a little bit about the project that you mentioned in the chat that y'all are doing, so we can look for it. And then while you're doing that, Rena could put up our schedule of like upcoming calls, because would you mind, Liz, telling us a little bit about
Not
it?
at all.
It's a great example.
And I want to say thank you to Jerry, because she's the one, I don't know if she remembers talking to me with the Duke Center for World Food Policy. I don't know, probably a year ago now. So thank you, Jerry. What we did was we funded Dr. Carolyn Barnes to do a study, which I will release hopefully within the next month, to do Eastern North Carolina. So we had rural, Mecklenburg County, and she's got another grant to do the center of the state, to do a deep dive and interview WIC and SNAP. So we can understand to Jerry's point. She knows, I mean, everything she has said is what we're finding, but there's additional barriers that are coming within, each different health department, unfortunately. So we're trying to make sure that we're holding, the biggest barrier, honestly, is holding our health departments and our state accountable. That's where we're finding a lot of the barriers is there. But also the stores, Carolyn said that it's also the stores. They're not marking a lot of the WIC products. They're running out of the WIC products. There's also issues in that as well. So the project's been going on for just about a year, and she's just coming up with recommendations. And so we'll be able to move on that.
We'd love to share that
Yeah.
I think that would be something people would like to see and they could replicate. It's a really good example of a way that a funder could leverage money from federal money by pointing out the way it could work better. And so
can I say one other thing, Shannon?
Yeah,
one more thing is that one of the things we want to push for, and we're going to use our hopefully our funders as it, is that when they give grants to food banks and all that kind of stuff that people are pushing out, that they put a requirement in there that says you have to screen for WIC and SNAP. And that's where that's the problem, that they could screen for WIC. I mean, for SNAP, maybe not as much for WIC. The problem we're having is that there's none of that happening. The food banks and everything are pushing it out, but there's nobody screening. So they're not able to get the access going. Does that make sense?
Yeah, I think that's helpful.
So that was another area. So I'm done.
Thank you. I'm glad we had that example. So you'll see tomorrow, or no, actually, I guess it's next week. I think tomorrow the Alliance for Early Success is having a child welfare, and we had sent that around. You all should have gotten that. And you see over the next couple of weeks, we have some exciting stuff going on in terms of this new network about children and immigrant families. We really hope y'all dial in to learn about it. And we have some additional things we're going to hear about parent practitioner organizing. And you can see we're partnering. We always help the Alliance and they help us. And they are going to talk about Black infant maternal mortality. So in closing, I think we've lost some folks. I'll just say one thing that always strikes me about this is the food, even as much as the childcare, is we have this I don't know, we can't just give people anything because they need it to live. We've got to layer on and layer on because we're suspicious about who deserves things. And, it always, I think there's a systemic suspicion of people and their humanity and deserving access to basic things that always, comes out when we have these conversations. And I would be hopeful, but maybe overly Pollyanna-ish to think that this current crises, the multiple pandemics that we're suffering, would help us get over that. But I want to thank you, Jerry, because you are such a treasure in terms of your expertise in this. It's a mixture of things that are very basic and very arcane, and you master it all. And I really appreciate you, being here and sharing with us. So we look forward to seeing y'all next week. A lot of opportunities next week. And I hope until then you have a good week.
Thanks so much.
Thanks.